Hello everyone, my name is Laith, one of the authors of the COVID Ready study, Survey of Volunteering and Medical Education during COVID-19 for UK medical students. On the 24th of March, the UK Health Secretary announced plans for medical students to volunteer during the pandemic. In the COVID Ready study, we aim to determine, firstly, the willingness of medical students to volunteer, and secondly, how prepared students felt. The population so far is 512 students across 30 medical schools spanning all years in the UK. In terms of willingness to volunteer, the majority, 84%, were willing to volunteer and 39% had already started. Positive motivators included altruism, with 93% of students citing this as a factor, but also career development and personal development. There were negative motivators too, like feeling of guilt in almost half of the respondents and peer pressure in 1 in 10. Barriers to volunteering were varied: family and social commitments in 64% of cases, a lack of PPE in 52%, and a fear of catching coronavirus in 40% of cases. Preparedness results were mixed. While 63% of students felt they had received sufficient medical education to volunteer, 82% wanted additional training before starting. Only 11% had had teaching on pandemic influenza, and only 29% on donning and doffing PPE. The majority of students, 62%, did not want to undertake a full clinical role expected of a newly qualified doctor. Importantly, only 8% of students knew how to exception report and 28% knew how to report clinical incidences. Whilst these data are encouraging and show that many students want to volunteer, we need to be mindful of the areas that can be improved. For example, proactive approaches against peer pressure, better training for PPE, and improved awareness of safety mechanisms like incident reporting. We're currently analysing the qualitative data to identify ethical themes medical students feel are important when being asked to volunteer. Thank you for listening.